Good day, this is Mark Van Cura, and I'll be lecturing today on analysis of an exam. Marco Rabazzo, you'll see at the upper part of the screen, he's a videographer and editor, and he may be interposing some questions that were typically asked by students as I'm going through this. And of course the purpose of it is that that's one of the biggest problems most students have, is taking exams. It's the reason being is whether they don't read it or they rush it or they overthink things and start changing answers. So what I'm going to do is I'm going to show you an example of a test that's given for A&P I, A&P II, excuse me. And
can we analyze one of the multiple choice questions?
Absolutely. Yeah. Why don't we start with question number 1? And so I always say, if you're taking an exam and it's a multiple choice test, you want to really turn it into a true-false question. And therefore look at each answer and then look at the question and analyze what the question is asking, and then look at each of the answers and say, what is that answer answering? So therefore it says the LAV. Well, I know the LAV, and I'm just going to write this on this page for you. Just remember the LAV is another name for the left atrial ventricular valve. And if you've watched the lectures in that, you'll see that the LAV is also called the mitral valve, and it's also called the bicuspid valve. And so when you analyze a question and you say, well, gee, where is that valve really located? And kind of just think that if this is my box heart, and again, if you just keep on going over that box heart and just remember in the lectures I've given you where things are located. Remember, this is your right atrium. You're looking down at the patient, anatomical position, right ventricle, left atrium, left ventricle. And so therefore the LAV, just by its name, is between the left atrium and the left ventricle. So now we know what it's talking about. So now let's take a look at that question we've got here. So we know the LAV. Where is it located? Well, it says it's located between the left atrium and the right ventricle. Well, I know that's wrong because we just said it's between the left atrium and left ventricle. So therefore that's false. It can't be that answer. So it would be between the LA and the LV. It says it's known as the tricuspid valve. Well, again, if you notice when I just analyzed the question, it's also known as the bicuspid valve. Remember, bicuspid just means 2 points. So if this is the chamber, and this is the one below it, and this is the LA, and this is the LV, here's that valve. And it's got 2 points, hence it's called the bicuspid valve. So therefore it's not also known as the tricuspid, it's known as the bicuspid. And therefore that's false. Now it says it's attached to the pectinate muscles by trabeculae carinae. So again, if we look inside of the chamber, we know that we're talking about a valve, so let's just draw this very simply for today. And again, you can draw this box heart over and over because it is so important in anatomy and physiology and allied health careers. And also if you're going into medicine, dentistry, whatever. Here's your valve sitting here. So we know that that valve has got 2 points to it. We know that coming from that point is going to be something called a heartstring. So those are the heartstrings. And remember, the heartstrings from the video lecture are also called chordae tendineae. And therefore, they're then attached to specialized muscle in the wall of the heart. And of course, that's in the left ventricle, and those are called papillary muscles. So now if we know the anatomy of the heart, when we go back to the question, it says the left atrial ventricular valve says it's attached to pectinate. Of course, we know that's now going to be papillary. And by trabeculae carne, and we know that's going to be wrong because we know it's going to be by chordae tendineae. So therefore that's false. Now we know that the next answer says both B and C. Well, we've just said B and C are false, so that's false. And now the last one left, it says prevents backflow into the left atrium during left ventricular systole. Remember, systole is pumping, and therefore that's going to be a true statement, because that actually tells you the function of that valve. And again, if you recall from the lecture, I explained to you that, again, if you're looking at your chambers of your heart, and we'll just draw that box real quickly here just to make sure you understand it. If this valve is sitting here between these two chambers, and this is this is RA, RV, LA, LV. And I know that there's another valve over here, and that's going to be the aortic valve. But when that heart is pumping blood out, I don't want the blood to go backflow inside of the left atrium. So therefore, the correct answer is going to prevent backflow into the left atrium during left ventricular systole. So remember, systole is heart pumping. And if you do that with each, multiple choice question, you'll see, wow, this is really not that complicated. It's just a matter of, tests are a great way, analyzing old exams are a great way to learn material, to do well in the course, but also do well in your future careers. So that's why I do these like this. So let's just try another one down here. And let's take a look at, let's just analyze number 5. There's another multiple choice question. It says blood is classified. Well, there's different things. You can classify something as connective tissue, epidermal tissue, you've got muscle, you've got all kind of different tissues in the body. But when we think about blood, we want to remember that, is it a liquid? Yeah, well, blood's a liquid. Until it coagulates and becomes a scab, it's a liquid. So that's true so far. But the next thing says it's an organ, and I know it's not an organ, so that's false. The next one says it's a mesodermal liquid connective tissue. Well, let's think about that. Mesoderm is a germ layer. So remember, we have 3 germ layers. And those 3 germ layers are endoderm, ectoderm, and mesoderm. So just remember endo, ecto, meso. And if you, again, look at the lectures that I've given you, remember that blood comes from mesoderm. It's got a mesodermal germ layer origin. And we know it's liquid, and we know that it is really all connective tissue. All connective tissue has got a mesodermal germ origin. So it's considered to be a mesodermal liquid connective tissue. So this is the way that you'll see tests in allied health. It's going to be, what's the best answer? So if the only answer here possibly was a liquid, well, I guess you could say it's a liquid. But when you get down here, let's go to the next one. D, let's just figure that out. So we know this is true. And now we got this question here is hemopoietic tissue. Poiesis is creation. So that means, is blood create itself? And the answer is no. So hemopoiesis is blood cell creation or formation. And I use the word creation because that's the absolute meaning of poiesis, but creation or formation. And you know, blood cannot produce itself. It has to rely on red marrow or myeloid tissue in order to do that. So therefore, blood is not hemopoietic tissue, so that's false. E says all of these, well obviously it can't be that, so that's false. And therefore the question is, what's the best answer? The answer is, blood is a mesodermal, liquid, connective tissue, and there's your correct answer to that question. Let's just try another multiple choice
How
question.
about we do a true-false one?
Sure, we can do a true-false. Let me get you over some true-false questions. So, question is, you know, how do you analyze a true-false question? So let's just take a look at question 92. It says the cardiac notch is in the left lung. So let's see, the cardiac notch is in the left lung. Let's think about that. I know that here's my thoracic cavity, and here's my diaphragm separating the thorax from the abdominal pelvic region. And I know that here I've got my lungs. My lungs are sitting on either side of that. And I know that since this is my right lung over here, and this is my left lung, and I know that my heart is really sitting inside of here. So therefore, since my heart, as I'm looking again down at the patient, and I'm just going to I call it a Valentine heart for this, but as that heart actually is in your body, you always talk about how your heart is shifted over to the left. Remember when you're looking at the heart, and again, I'm just drawing, even though that's not really, but I call it the Valentine heart. But therefore, if you just think about, remember in the heart, this is the base of the heart, is up here. So that's what's strange. The base of the heart is at the top, and the apex of the heart is at the bottom. Just the opposite in the lung, because if we were covering lungs, the apex of the lung is the top, and the bottom of the lung is the base. But if you take a chest film of someone, you'll see normally the heart is shifted over to the left. And because it shifts over to the left, it actually infringes on the room there is for the lung. And so the left lung, if you were to look at it, has only 2 lobes. And so therefore, if this is the right lung sitting here, and this is the left lung next to it, and here's the left lung over here, there's a notch that fits in here, which is called the cardiac notch. And the cardiac notch is where the apex of the heart actually fits into that notch. Hence, the left lung has only got 2 lobes, which is an upper lobe and a lower lobe, and the right lung has got 3 lobes, and that would be an upper and a middle and a lower lobe. So that tells you 2 things. The other thing, I always think of pathology, and that you may have a patient come in and you'll look at their chest film and say, wow, that heart is actually shifted over to the right. That doesn't seem right. And the reason being is, remember, the heart's located inside of that mediastinum. So the first thing you'd probably look in his history physical and look at his history, and maybe he was a long-term smoker, and he may have some, remember, inside of that mediastinum are lymph nodes in the heart and the great vessels. And sure enough, that person may have lung cancer, and some of those nodes are so large that it's pushing the heart over to the right side. And therefore, you're thinking, why is it doing it? And the answer, he could very easily have metastatic lung cancer that spread to the mediastinum. So let's just analyze one more question. I think I'll just do one more question, just give you an example. And let me analyze another question I think that's a great one to analyze. It's number 12. It says, John was diagnosed at age 3 with an atrial septal defect. Well, remember, an atrial septal defect from my lectures is an ASD. And I told you in the lectures that atrial septal defects are a normal hole is present in the fetus between the right atrium and the left atrium because the lungs aren't functioning and the placenta is working as the fetal lung. And of course, when that does not normally close up, it becomes what's called a PFO, or a patent foramen ovale. And that patent foramen ovale is another name for an atrial septal defect. So if you just draw this very simply and say, here's my chambers, and I'll just give you the 2 chambers because we're just looking at the atrial chambers, the pumping chambers. So remember, this is going to be the RA, or the right atrium, and we'll just show that that's the chamber. This is going to be the LA, or the left atrium. And we know when you were a fetus, there was a hole between your 2 upper chambers, and that was called the foramen ovale. Remember, that was just a fetal structure, and that allowed mixing of the blood between those 2 chambers because, again, the lungs were non-oxygenated blood. When you took your first breath of air, basically what happened was that actually started closing up, and by 3 weeks should have closed up. So as it closes up, so when the foramen ovale closes, and we'll say, I call it a deltart, but somewhere in 3 to 6 weeks, and in some people it never totally closes, but as it closes, you're going to see that indentation in each of the upper chambers of the heart, something called the fossa, which is a fossa ovalis, which is a oval depression. This totally is gone, okay? And if it stays open, then therefore, if the foramen ovale stays open after 3 to 6 weeks, or whatever time frame that we set, that would be called a PFO. And a PFO is a patent foramen ovale. And that's called a atrial septal defect. So the next one says, we know that. So now we've got a picture in our mind where this is located and what it does, because that's important. And then it says the layers of the endocardium of both ventricles. So it says if he has atrial septal defect, the layers include the endocardium of both ventricles. Well, remember, first of all, we know that that's totally wrong, because remember, it's not between the ventricles, it's between both atria. So therefore, remember, those layers have to pass through, that opening has to pass through all of those layers of the heart. So kind of think of that, if you had to repair that, remember that you've got what kind of layers that you have in the heart. Well, if this is the RA and this is the LA, we've got the endocardium of the right atrium. We've got the myocardium of the right atrium. We've got the myocardium of the interatrial septum. We've got the myocardium of the left atrium, and we've got the endocardium of the left atrium. So if I had to repair one of these, realize the layers that I would have to repair in a child if it did not close up. So it tells me that A is false. It says it might close up, leaving an oval depression in both ventricles. Well, again, it might close up. Matter of fact, it generally closes up, leaving an oval depression. Remember, that's the fossa ovalis. But it's not in both ventricles, it's in both atria. So therefore, that's false. It says if left untreated, it will result in mixing of blood between the right and left heart. And obviously, if we know that if this maintains open after birth, you're breathing, but because it's going to allow some mixing here, when you do a pulse ox, you'll see that those persons have a pulse ox that's going to be lower than a normal person, but it's not very easily caught, because if you ever do any work with a pulse ox, you'll notice that they're really not that sensitive in how they work. So therefore, that's a true statement. And then it says it's between the right and then finally D said it's known as a VSD, and that's false because it's known as a ASD, or an atrial septal defect. So therefore the only true statement is C. And now what you've done, you've analyzed the heart, you've gone over the anatomy of the heart, and you've learned about some very important pathology of the heart.
So what should I study for the
Well,
exam?
I always tell students that, exams are very difficult because it's hard to test a student's knowledge with an exam. There's so much material. And so therefore, for a class that's taught online, that's why I weight exams less on an online exam, an online course, than a face-to-face course, because one, they're unproctored, but two, there's no way of even during a face-to-face, so many people are not great test takers. And of course, because I've given you all these chapter review questions, a lot of students don't believe me, and I tell them, please just study the sample exam, analyze it, and your questions for the exam will come directly from some of those questions, so that all of the questions are found inside of those 100 questions on this exam. So that's what I want you to understand. And so the other thing, if you notice, if you take a look at the immunity paper and see that there's 20 questions on the immunity paper, you'll see that those questions are exactly the same questions found in 39 through 58 of the test. So it's 20 repeated questions. So I would say I would read the paper and you'll be able to answer these questions, not only that you see inside of the immunity paper, but also in this sample exam. And so what you want to do again is study this sample exam, and again, don't get carried away that there's so many things to know in those chapters that how could I possibly test you on that? So it's always important to, like I say, just take your time and study and analyze the old exam. Any other questions we want to look at?
No, I think that, I think that helps out.
Just remember that the most important thing is to read the question, analyze what the question's asking, analyze the answers, determine what the answer is really responding to, make sure you know what those definitions are of the word, and then it becomes very easy to answer a question. And like I say, one of the big problems students have is A, they rush through something, and B, they memorize and don't analyze. And so that's why I teach you in this course not only the anatomy and physiology concepts, but I also teach you how to analyze, critically think, and do well on an exam. Well, thank you, study hard, and you'll be getting probably in some more videos as we move along through the semester. Thank you.